Okay.
Hi, Ira.
Hi, Karen.
It's really good to have you here again today. And today I want to talk about Ira's book. Well, it's backwards on the screen, but Handling Mr. Hyde. And Ira, you wrote this book with your brother Stan. And
Yep.
I want to just read a little bit from the preface here so people understand what this is about. And it starts like this. Imagine an illness that strikes at the beginning of the prime of life, robbing an individual of his insight and personality to such an extent that he might lose his career, wealth, friends, family, and even his life. This is the nature of manic depression, otherwise known as bipolar disorder. The most problematic symptom that patients, their families, and friends must deal with is the loss of personality. Because of this loss, the patient loses insight, so much so that for the intents and purposes of assistance, the person who inhabited the body is no longer present. But a different person, one who believes all is well, now inhabits the body. Thus, the disease, the real enemy, seems to be one and the same with the person who needs help. I really like the way that you've structured the book, that you've put it together in 8 chapters, starting with your personal experience with your brother Stan, and then moving on through how the physiological illness causes the behavior problems. You talk about the way that medication is used and how the behavioral processes or the biochemical processes are affected by this. You look at treatment. In chapter 5, and I find this particularly fascinating, I hope you can talk about this a little bit, you look at the issue of free will, because I know this is an area that people struggle with a lot. And then you mention the day-to-day issues, what it's like in personal relationships with a person who is struggling with bipolar disorder. You also touch on the bureaucracy, the government systems, the medical systems, and how that affects treatment and how that affects families. And then you ended up by looking at how society deals with this illness. So I think you've covered all the bases. This book looks like it would be a very, very helpful book for people who are personally dealing with this illness, because your brother Stan talks about it from inside the illness to give us insights into what he was going through. But you've also looked at it from the family side, from your side. And I just wondered if you could talk with us about that. Maybe as a background, you could tell me a little bit about how you first got interested in Jordan Peterson and Paul Vanderklay, because that's how I found you, and that's how I found out about your book. And then you could talk about the book. Does that sound like a good plan?
Yeah, it's going to be a little bit of time to go through those things and
Well,
interrupt
that's okay.
whenever.
We've got time.
So, starting with how I found you, and then so many of the others, I think, that are part of your conversations, and through then Paul Vanderklay and then Jordan Peterson before, could start with something, and I would say with more and more of the conversations between Paul and, say, you and Carl, I came to Jordan kind of through the libertarian side, even though I wouldn't call myself a pure libertarian. I once wrote a little article calling myself a reactionary libertarian, sort of like Carl saying being conservative, certainly not libertine, but the sense of conserving things. And we can even talk about, one of Paul's conversation recently with the other pastor, Pastor Pete, I think really shows like a radical pastor. He called himself that, and how I would disagree strongly with what he described from that reactionary conservative side. But anyway, that sense of libertarian and the sense of how in the libertarian circles, there's more and more about these kind of issues that are, say, meaning crisis. Oh. And then, like I said, I see more in the meaning crisis little corner of the internet, like the radio host Gronkowski. If I get his name wrong, I'm sure it's wrong, but he did the description of Rene Girard and things, and he was coming at this Ron Paul campaign worker and things like this. So those two worlds were kind of coming together, and where specifically for me was there's a blogger named Bionic Mosquito who started really as a libertarian blogger, and now almost every post is about meaning, Christianity, and how it ties back to liberty. And I think it's quite interesting how I think those things go quite together. So anyway, from this Bionic Mosquito blog, it was maybe a comment or something. I had never before heard the name Jordan Peterson before, but there was something he's doing this Bible series. And I started and just did a kind of August. I live in France, by the way, so I'm American, but I live in France. So in August, I find time to do things. It's not so busy at work, and I have sort of insomnia. So I kind of went through the whole series in a week, maybe week and a half.
Well,
and I wrote a little.
That's major.
It's work. It's work. So
it took me maybe 3 weeks.
I wrote a little article about that. And then about 2 or 3 weeks ago, or 4 weeks ago, you were talking to, I think, Sherry and, I can't know, Esther, yeah.
Yes,
and mentioned Hayek and some other thing, Austrian economics. And that's when, I said, okay, maybe I'll send you a message. Because I'm not a commenter on the stuff, so I've been listening, and I've listened to lots of Paul and all his conversations, and got into Vervaeke and all the others. So I wrote another little article. I usually write these articles for a website that's quite well visited in libertarian circles and maybe wider, called LouRockwell.com. Lou Rockwell was the man who started the von Mises Institute. And in this article, I said I was following Peterson's progeny, for me, that is, coming from Peterson and then just branching out. Some things I've heard of before but never read, like what were some of the, from Paul, talked about Tolstoy's Confessions, and I read that one, and Man's Search for Meaning.
Viktor Frankl?
Yeah, Frankl, and then on, and especially from Paul and all his things, and for example, from you. And I made a special note of many of the others, certainly Vervaeke, Jonathan Peugeot, his brother, but also just all the conversations, and how I think how not just, they're interesting in the sense like reality TV, but where kind of the amateurs really have insights into the things that you're not getting necessarily from the professionals, say. So so when you invited me to talk a little bit, I said, well, okay, maybe I need to get in the conversation a little bit. So that's the Jordan Peterson and Paul Vanderklay, especially, who are now, I kind of keep looking. And I don't subscribe either. I probably should subscribe. I'm not a joiner, I haven't subscribed to anything, but I watch all the time. So I don't know if that helps your numbers.
Well, the subscribing is I don't know if you've ever subscribed. I was a little worried about subscribing, but it's so simple. You just hit subscribe, and then all it does is it just notifies you when a new video comes out.
A new video comes out?
So then I always know when.
Well, I mentioned I'm kind of reactionary, so I resist all new technology up to a point. It's just like, I'll go check every day. Maybe I'll have to hit the subscribe button for a few of you anyway.
Well, it does help our numbers,
So if it helps.
Well, the thing is, if your subscribe numbers are really low, then the algorithm doesn't show your videos to anybody. So they just sit there.
I see.
But if your subscribe numbers go up, then the algorithm will put you in, and other people might discover you. So
it's the same as, what about views? Wait, what about views? How does, how the views goes into the algorithm or not? The number of views versus...
it does to some extent, but then every once in a while I notice that, like my second video with Carl, which I think was every bit as interesting as the first video, stalled out at 80 views. It just stopped, and no more views for a week, even though Paul had posted that video on his Twitter feed, which should have generated some views, but nothing. So My feeling is that at some point Google just shoves things aside, and they don't make them available to people.
Yeah, that certainly
So,
could be. They certainly are
yeah,
doing a lot
so
of
only the subscribers get to
algorithm.
see it. Yeah.
Yeah. All right. I'm shamed enough to hit a button every now and then. So, and the second part of your question, so um, that's a longer story, in the sense of my brother had this bipolar disorder, and this book was written about it's almost 20 years ago now. I don't know when I got it published. So what had happened is, he was as brilliant of a student as I know of. It was like undergraduate electrical engineering and pre-med, perfect on everything, goes on to do an MD, PhD in physiology, and then was starting his residency in, somewhere in medical school. It was the first episode when things happened that, those things were changing the personality. Were also, this is the other part of the difficulty of this, get into detail, is I would say, what is the main thing is there's a change in personality. It's been very focused on a personality change. Well, how many other people do you know, especially adolescents, people going through stressful periods, have a change in personality? Now, how do you pick that out? It's really difficult. And I think it's probably being way over diagnosed now. 5-year-olds or something, it seems crazy to me to be diagnosing something like that. Because also the whole diagnosis is another huge issue, extremely important. Basically trying to quantify behavior, and from that quantification, trying to come up with a diagnosis, because there's no blood test, there's no anything else. Mm-hmm. So this is another enormous issue that you could talk about related to this illness and other mental illnesses. So anyway, then through the long course of that illness, over say that was 10 years or so, we finally came to the point where he couldn't find work as a physician. It was all kinds of fundamental health problems, but also legal problems, on and on. And again, I think not everything's in the book. Things coming at the same time or afterward. But anyway, in the course of that, and all the time that I was trying to help him, I came to that point of where one is to be out of stress, so to avoid maybe having this psychotic type of manic episode. He would go down into sort of a depressive state, which means he's almost doing nothing, so it's not good either. I mean, and worse. So the sense was, I really wanted to keep that. I thought, not to coin the phrase, use the phrase from the film, like a beautiful mind. It's like, you can't waste this. So the sense of him as to get him to write about the experiences and to add his medical knowledge to the explanations is something would be unique coming from a patient like that. And the sense, but for me, it was more of like a therapy thing. That let's do this. And he goes, I don't think I could do it myself. So, okay, look, I'll write it with you. We'll just talk. So we have a discussion. I pose a question, and then put down, form his responses, and then have my own response as sort of the outside observer, but the observer in the process as well. And the fact, both of us, my brother, to the point, he became so ill he couldn't continue in that career path, was a scientist. He published papers in Journal of Applied Physiology, things like this. And my career has been engineering, mechanical engineering, but teaching and science, a lot of research papers and things and books. So I thought we had a potential to be able to write something. And just as an aside to that process, and this was, say, enough years ago, it was before Amazon, etc. But its purpose was personal therapeutic. I thought, I believe, it could be valuable to people, and why not see if it would be published. So I took that old way of going around where you send it to agents and this kind of thing, and made some effort and had a little bit of interest, but didn't really go anywhere. And then just said, well, I don't care. And then saw a kind of self-publishing, and that's what I did. Now I think it's so much easier to do that, and maybe I've thought a little bit about reformatting it into Kindle or something like that. I think the last publisher or something did that. But so anyway, that's the gist of how this started, and then some of the different chapters that you talked about came from, I mean, literally like years of thinking about what are the fundamental problems. This is, I guess, as an engineer and a scientist, you kind of, what's going on here in terms of pulling it apart, the problem. And that's where the problem of, say, bureaucracy, it's not just government bureaucracy, but like credit card companies, employers, and all these other people, the law in general, police, all of them came into play. And then the aspect of free will is, again, something now you see over and over again in all these conversations Paul is having and among everybody. But here's the case. It's like, well, literally he was being accused of crimes and being put in jail when he had this illness. And it wasn't him. So in his sense, there was like no free will.
So the book is called Handling Mr. Hyde.
Right.
So why don't you talk about the title there and how that fits into this?
So that clearly shows another one of my interests, that came later in life, but is literature. And this aspect of Robert Louis Stevenson's book about Dr. Jekyll and the strange case of Dr. Jekyll and Mr. Hyde is one of the things that came to my mind, as though it's not a perfect analogy in the sense of Dr. Jekyll, the nice Dr. Jekyll, because my brother was Dr. Katz. For Dr. Jekyll, he sort of brought that on himself by a bit of hubris, this modernity of playing with things that are beyond maybe human ability to deal with, and he changed into another person. So this was Mr. Hyde. And so as somebody who was there dealing with Dr. Jekyll, Mr. Hyde, is like, well, I want to help Dr. Jekyll, but this Mr. Hyde's in the way. Well, that's a sense of what I felt with my brother, is there's my brother there. And but even in the midst of that psychosis, even his face would change, his looks would change, his voice would change. So even on the phone, I could talk to him for 30 seconds and know what was going on.
You could tell he was a different person.
Oh, yeah. I mean, usually, for example, he often had a psychosis that he thought he was God, and was typical, and all kinds of crazy things. He wrote about some of them. So that sense of the difference, which was obvious after being his brother, growing up together, and then dealing with that, was there, which is one of the other things about, the psychiatric profession. You see like this expert witness say they talk to the patient for an hour. I've had my brother with experts in that illness, talk to him and know him before, talk to him, for a session, and come back and say, well, things are going good. And I say, excuse me, doctor, right now, he believes he's God. You have no ability to understand what the patient is thinking whatsoever. And that is
typical. So one of the things that I noticed, that when I was reading some of Stanley's testimony in the book, that when he was inside it, he was completely unaware that anything was going on, because it seemed perfectly normal to him. This new space that he was in, he inhabited, it seemed perfectly normal to him, and he had no idea that he was in a bad place.
Yeah, certainly.
And because he was very intellectual, very intelligent, and very disciplined person, he could put this across to the doctors, and they wouldn't understand anything of what was going on.
That's a big part. Probably, again, because he was, I mean, he literally took courses in this. You know, he knew the questions they would ask, et cetera. He could answer them perfectly. And again, kind of like, but actually he was in a way, often he wouldn't lie, you know, but he'd parse the questions.
I noticed that
Like,
in one place.
like a politician, you know, or
They
somebody.
said, "Do you think you're God?" And he said, I could say no, perfectly honestly, because I didn't think it, I knew it.
Yeah, which is again, think of that in terms of all the Vervaeke and Paul's discussions
Uh-huh.
and how you can take the word and manipulate it and what that means. But that was what was going on in,
Well, I have
in
no,
this.
I'm not in any way saying that I can understand where Stanley was at or what he was going through or what you were going through. But even on a very small scale, I can notice in myself, I have a bit of an issue with a food addiction. And when that food addiction decides to take over, I am so good at lying to myself,
Hmm.
and not a part of my brain is somewhat aware, look, you're lying to yourself, and the other part of the brain can just shut that part of the brain off, and I can just head down that path. So it's very easy for me to understand how, if a person is in an extreme state like that, that you can compartmentalize, completely lie to yourself and not have any awareness.
I don't know how it was with him exactly. I was with him sometimes when he was like going, and to me, he seemed to always be fighting it, you know,
Hmm.
doing whatever they take. Certainly, there's another big one. Certainly, you know, they would, and again, you'll hear this everywhere. I'm sure you've heard this, and everybody who ever sees this will hear somebody saying, "Oh, he stopped taking his medication. That's why." No, the medication failed. That's why he stopped taking the medication. When he was psychotic, he stopped taking the medication. He didn't stop taking the medication and became psychotic.
So,
You know,
so
it did not control.
the psychotic thing starts to take over, and then he thinks, "Oh, I don't need the medication anymore because
Right.
everything's great."
It's an absolute failure of the medication,
Hmm.
you know, over and over again. And again, the science of those things, it's been 20 years since I studied them, but I don't think there's, and even with Vervaeke and Jonathan Haidt, that's another one I've read, you know, recently. I still have so much doubt about these psychiatrists. I think I have more respect for psychologists now, but
Hmm.
psychiatrists, you know, they think they can take an image and then say what somebody's thinking. I have great hesitancy to believe any of that. And, you know, certainly the drugs, you know, the design of the studies was pathetic, you know, just to get approval. Usually they don't have new molecules, so they can really skirt the issues and just use, you know, different things, whatever. And, you know, so a typical study at that time, you know, might last 4 to 6 weeks. Well, that's nothing. I mean, that's meaningless data to me, because that's, and of course, you might see something better if you have a patient that's been in bad shape, and for 4 to 6 weeks you're giving medication. That is also the whole environment is changing. Yeah, you're going to have an effect because the environment is enormous effect. To me, the data was just junk. And
So let me just clarify. So the reason 4 to 6 weeks is insufficient is that sometimes it would take a much longer period of time before this problem would show up for Stanley.
yeah, so the first time he had, for that first time when he was about 25, 26, and really I was no idea what was going on. There's a whole, you know, story about that. But he ended up being put in the hospital. He was like trying to get on a plane without a ticket or something. And this is where the society comes in and says, "Oh, we're going to do something." You know, lucky didn't get shot. Or if that happened today, he probably have.
Oh, Stanley, Ira, I lost you.
Yeah, it was just for a second. So
Oh,
I was
okay.
just, I was just saying, you know, he was trying to get on an airplane, and then the police took him to the hospital. And again, who knows what would have happened today? So there are many times he easily could have been harmed tremendously by his actions, you know, in society as it exists. But at that time, I think without going through the what's like the DSM, the Diagnostic Statistical Manual protocol, for the quantitative assessment to say manic depression, the physician said, well, it's clearly bipolar, and started prescribing lithium, which was like the first big drug for that. And again, you could say, well, it was successful because the next big episode didn't happen for another almost, it's been a long time since I looked at the book actually
I
myself,
think
and
it
my
was
memory is
yeah, I
about
think
4
it
or
was
5
a
years
couple of
later.
years.
Yeah, at least more than a couple of years, because it was then after he went through his whole internship and then into his residency.
Oh,
that
okay,
then
that's right, because
it-
the first episode was 1986, I think, and then the second one was 1990.
Yeah, right.
Yeah.
So you could say lithium worked for that long in the sense he didn't have a psychotic episode, though he had much more trouble than I realized at the time in fighting just the downside. Imagine trying to be a high-powered medical student, with all those hours, really like the worst thing he could have been involved in, when your body is being shut down in depression. And hopefully now these programs are understanding, but there was no understanding in any of these people who didn't know him before he was ill. The people who did was that original group. He had his research team that he was part of, and those mentors. But all the way through, I can name a bunch of them. You're fired for being sick, pure and simple. Oh, your problem. You didn't do your work. What? You didn't do your work. If he couldn't get to rounds because he had broken legs, he wouldn't necessarily be fired, but he couldn't work because of this illness. So anyway, you could say lithium worked for that time, but okay, I mean, how long are you supposed to have it then where they start coming back? And then what didn't control at all, and they go off, try all kinds of other medications. And by the way, it destroyed his thyroid. And then, the rest of the story, I have another article. He ended up dying quite young at 52 with pancreatic cancer. And the last medication he was taking for a long time was something called valproic acid, which actually they give people now, I think, to treat cancer somewhat. But I don't think there's many people. I tried looking at the literature to find a relation between valproic acid and pancreatic cancer. In I can't remember the name of the book, the big physician's desk reference for valproic acid, one of the side effects is pancreatitis. That is, some illness of the pancreas, some inflammation or something coming from this. And I don't think there's so many people, because that was relatively new when he started taking it. He'd been taking it for, a decade and a half. But otherwise, he came up with the problems in his stomach, and then finally did a X-ray, and there was a huge tumor, and there was no chance really at that point. So he ended up dying of pancreatic cancer. But so it's a tough set of circumstances for sure. So anyway, I didn't do a nice, smooth description of all that, jumping around. Any other part of that story that you're interested in, we could go into a little bit more depth.
Well, yeah. Would you just touch on the issue of how free will, how that even came up to be a part of the book?
Well, this was before I started writing things, in kind of a formal, semi-formal. I mean, since then, we did this book, and I've had another book on fluid mechanics, which is another subject you mentioned offline we're interested in. And then I've been writing scientific papers, but the sense of writing on a more general scale about all kinds of things, it was something much late, certainly as a college student, the last thing I would have ever thought of. But this started growing for me, they say my 30s especially, late 20s, 30s. And so as these issues came up, I mean, so again, you have Mr. Hyde there. Mr. Hyde literally committing crimes and is getting put in jail and is doing other really terrible things. And not really terrible things, I should say. He really never did anything really terrible. He's certainly being so crazed, scared the bejesus out of some people. Some women, for example. And I would tell them, if you're scared, absolutely call the police. But he's never harmed anybody. He, but it's totally understandable. So anyway, the sense of it is, and then it goes wider and wider. Does he have free will in that state? Because if you don't have free will, you're not a moral agent, and you can't be doing anything wrong.
So the question was, in your mind, was the illness actually taking control of his will?
Yeah. So my opinion at the end is the Mr. Hyde was not my brother, and that Mr. Hyde, the psychotic being, may have been guilty, but my brother wasn't. Mm-hmm. My brother was worth all the help, I could find to get him over that. Because so many people they can't get over that point, because the person there is doing things that are not nice. They're talking bad things, they're doing other things. And when society, your job, say, or then especially then your family, your loved ones say, no, you're a bad person, we don't want to have anything to do with you. I mean, then you're really in trouble. I mean, that's probably a death sentence, within the next few years for somebody. So,
but because of the love that you had for your brother, you were able to see through right. the thing taking him over and still see who he actually was on the inside.
Yeah, probably like, a lot of things. What is the P? This, or the 4 P's of knowledge, from Vervaeke, the propositional part came later.
Perspectival, participatory, and what's the other one?
Yeah. So the participatory, I mean, that was there. So it's in the process of, okay, what am I, being on an airplane, looking for him, or sitting at the police station or a court or a hospital. To me, those questions came together, and I said, well, I want to write this down. And then I could come across an article like in the 90s in the United States was the decade of the brain. And something like a popular sense is, oh, yes, we know everything about the brain. It's all being mapped out. We got it there. So, you don't know this. I don't think you're going to know lots and lots of other things by that propositional way of analysis, I think, which Vervaeke, in a way, I would say, supports. So it was in those kind of moments that I would put an essay like that together. So in the end, when we had the book, and I said we started the book was for the point of getting my brother to use his faculties, to think things through, to practice. If you're not practicing and you shut everything down, again, it keeps getting less and less and less. Let's think, let's write some things down. And so to me, the way those essays came in, they were secondary, and actually I originally would have those as an appendix, but one agent said, oh, why don't you put this, try to make it more jazzy, which, the purpose to me wasn't to be more jazzy, it was to get down what we could learn about it. So, but anyway, that's where that essay on free will came. That was my description of this trip to go find him one time, which just, was just a free-flowing email that I just put in there. And then the bureaucracy one was also maybe as my libertarian understanding of things, and just, again, recognizing what would happen. Why do these people, these organizations, have a terrible time dealing with this? It's like, oh, we can't tell you what's going on. You're the family member. Where without the family, it doesn't work. And actually, even more professional life, I see this over and over again. I give you, really specific examples all the time. You can't pay for the care. You have to have somebody love to get the care that's needed. And this is a big spectrum. It's not just mental illness, something like, I just was at a conference where somebody was talking about a cystic fibrosis patient. The parents divorced, and the father, who every day was on this child, you need to keep up your medication, everything else. The kid was 105% lung function, playing soccer, everything else at 16 years old. At 18 years old, was like 20% lung function, just totally collapsed because there wasn't the engagement, to make it happen.
You mean
So
after the parents divorced and the father wasn't there anymore to?
Yeah. So you probably maybe could say there's psychologically other things, certainly, but just even that physical part of it, here's somebody day in, day out on top of it who really knows everything. You can't just BS that person. They're there all the time.
What that brings up for me is in the state of California, and I don't remember exactly when they did this, but at some point they passed a law so that parents don't have access to their children's medical information anymore. And I can't remember if it's age 14 or age 18, but beyond that point, if the child is unwilling to sign permission to the parents to see the medical information, the parents can't see it. Well, if a child is struggling with mental illness, they're not about to hand over their medical information, or at least quite frequently they wouldn't be. So then the parent who is with them, who is paying the medical bills, paying for the insurance, taking care of the child, has no access to know what the doctor's doing, what the effects are. It's completely insane.
Yeah, it is. I mean, the insanity is more in the way it's the radical idea. We can take an idea. People should have privacy. And of course, what the government always seems to do is break it down to the lowest fraction. Isolate an individual when it's, the unit should be the family for that. And maybe a bigger, I think it depends on where you are, what the culture is, and where that point would be to say, who is medical records, who are financial things. And of course, families become dysfunctional and that screws up, but that's half because of the way the whole society is running. Those are the things to be building upon. And certainly for mental illness, it's all about this contact, the human contact. Maybe it's the agape, in a way, where you're rebuilding a life, with that. But that's what works. I mean, if maybe not working alone, often what you need is literally physical help. If the person, are you going to get in a fight to make them not go somewhere? I mean, that's when you'd like, maybe a legal, police or somebody to be helpful. I have less, again, also it's a sense of medications or expertise, again. So this was the sense of the book. I mean, I think I developed some expertise of the issues involved, even though, again, the other part is all of this stuff is so independent of the individual and even the individual over time, and even the illness, to me, they're just spectrums. There's some problem somewhere. They group a few symptoms sometimes and say, oh, let's call it manic depression here, or depression there, or something. But I don't think there is no real hard separation. It's some symptoms seem a little stronger, we'll call it that. Some symptoms seem a little stronger, we'll call it that. But I don't think, for so many people, it's something mixed in there, figuring out, or this, some people it's not the psychosis, like in my brother, maybe it's just something, they do seem just to be high and it doesn't seem to hurt them. There was another little aspect of this. There was a book written back in the 90s sometime by a psychiatrist who's actually also suffered from the illness. And she, based on the hypothesis or the statement that this is kind of the disease of genius, and pointing to certain individuals that in hindsight, were diagnosed with bipolar, say like a Van Gogh or a Beethoven or Churchill or some others, So again, is the diagnosis correct or not? I think that was mistaken. Again, it was sort of this like data bias that, if the truck driver had it and just lost his job and died, you never hear about it. But, or even like a bank clerk. But an artist, I don't think they were great because of the illness, maybe in spite of, but if they went through 6 months where they weren't productive, but they were great artists, it didn't cost them their career in a way. Then the next year they could maybe produce great things. But so that's another little thing you'll hear about regarding that. What I didn't like was the sense of it was just such a bad thing. I didn't like a way of saying, well, some good can come out of this. Because I didn't think anything. My brother wrote some long tract that was just ridiculous. It was so far away from coherence because there was no undergirding reality. Again, not to get into all these questions, what's reality, but as much as we can say, you were born this day, or the other big thing is he was a very good tennis player, but he had this illusions of grandeur of being like a star tennis player. Like, he wasn't that.
I noticed that in reading one of his essays. He talked about how that was one of the areas where he would get this.
He had never won Wimbledon.
Player in history.
Yeah, well, we could talk to Roger Federer or somebody and see what they think and compare the records. I think we can objectively make a case that he was mistaken in that. So
would you say that it's pretty hard to make the case that something good came out of it in Stanley's life? I mean, that might be very difficult, but for you, can you see anything in yourself that you feel that you grew or that you gained through the process?
Well, certainly, certainly, again, there's the sense, and this has been touched on by Paul quite a bit, and I don't know how many other conversations. It's just you recognize it is through suffering, through the great challenge, through the cross to bear. That's meaning in life. That's or the Peterson, obviously. So when the challenge comes, that you try to meet it, and certainly a message to me that's fundamental. And I've had more history of just my father died quite young, and it goes on to different kinds of things, and each one is to meet it. And actually, I remember one of the times I was when things really, I just what's going to happen to my brother, and I was on an airplane flying to Hawaii or something, to look for him, and I just happened to be reading at that time Uncle Tom's Cabin, the old Harriet Beecher Stowe kind of sentimentalized book, but description of a terrible life of slaves, in the Old South. But it did, hit a chord. I was like, well, my life, even Stan's life, maybe is not as maybe as brutal as these people are living through. And again, you look around the world, and it's always the case. Actually, just today, literally, just a couple hours ago, my wife had to take my daughter's cat to the vet to be put down. Yeah, so and she's doing pretty good because she cried a bit. We were talking about things like this, and it just so happens also today, her history teacher was like in the courtyard of the school. He was crying, and it turns out his son was on one of these scooters, or there's all these things going around every Paris, everywhere, and he was in an accident and was in a coma. This is the nature of things. It's maybe it's better to learn it earlier in a way that's not so devastating as my daughter has to go through her cat dying, but it's some of that, and that was the sense for me that was another thing, and I guess I've been hardened enough by different things that that's just the way I look at it. And I take that as a blessing, because otherwise, you really could fall apart. Because in a bit, my mother was like this. She had really anxiety, and maybe I took that as a reverse example, that okay, what's the next thing to do? Also, a big part of that is not to have the guilt when you can't do something, or maybe it seems to be something wrong, because you have no control. It's not an experiment. You can't say I did this first. You don't know what's going to work. You don't know if the other 10 choices you had would have worked better than what you did do in terms of trying to help somebody like that. Or should we stay with this doctor? Should we try more drugs or less drugs or this or that? Anything else? That second guessing, I think, is really unproductive because you don't even learn anything from it. I don't think. You almost could take the wrong ideas out of it. Oh, this time I have to do more of this versus that. It's not necessarily the case at all. So, yeah, I mean, there's no question. Obviously, it also made us very, very close. It's like, I mean, we were both going off in different directions in the sense of careers. I mean, once you try to do an academic career in the United States, I mean, you don't choose where you live. You just go where you get the 1 out of 200 job, chance of a job. So I was off then going to Texas, and he's, in this state, and those are that. And by the last few years of his life, and by this time I was living in France, I always was trying to get him to come and live with me. He was living now closer to my brother in Florida during the last 10 years of his life. So not that long, 5 or 6 years. I'm having trouble keeping, 10 years or so, keeping track of time. But I talked to him almost every day, virtually every day. And, I wouldn't have done that if he didn't have that illness. So is that a good thing? I mean, I'd rather have him healthy and being a star physician and having a great life, but we did have those things. And again, I think you saw, I wrote a little article after he died that expressed my sense of pride in having him as my brother, in through all that to be, a nice guy for one. He didn't express resentment, which is pretty easy to do after all that. And he still showed a tremendous amount of intelligence. I definitely still somebody I miss to call and say, well, what do you think about this in terms of anything going on? Now, once by that time, at least he had a chance to know my daughter a little bit, because that's like the only child in our family. So this was good. My mother didn't have a chance to see that, but so anyway, yeah, it was a good coming out of it. I guess that's the thing about, again, Paul's talked about, and how strange life is. So maybe some of the worst things is when the best things we happen to us in life, perhaps. That's I'm a Christian believer, so for me that was another solid base that I could have.
Well, when I read that article that you wrote about your brother's life and the pride that you had in him and the love that you had for him, I was just so deeply touched. That was one of the things that really made me want to talk to you. And then I have a confession to make to all our listeners, is that last week or the week before, you and I had this fantastic conversation where you talked about your childhood and how you came to faith in Christ, and it was an amazing conversation. And I had somehow pushed the wrong button on the record on Zoom, and I lost the whole thing.
Somebody up there knows about it.
Yeah.
Okay.
So,
at some point we'll get another one, maybe not.
Yeah. So maybe at some point we can have another conversation where you can give some of your backstory now that people kind of know about this book. And before we wrap it up, I wanted to say I was watching this video last night of Norman Doidge. Are you familiar with who he is? He is
I don't.
you might have read something by him, because he's a neuroscientist, and he actually wrote the foreword to 12 Rules for Life. That wonderful
Okay.
foreword where he talked about his friendship with Jordan Peterson.
Actually, I have to say, of all the Peterson I watched now, I haven't read his books.
Oh, okay.
You know, actually, I have another confession about books, even though, and I said the exception. I have a guideline. It's not a rule, but it's a guideline. It's never to read books that are less than 50 years old. It's a filter for a lot of stuff that's not so good. You know? But I did read Matthew Pageau's book on symbolism and
Okay.
something, and Jonathan Haidt's book on the happiness hypothesis. But you know, it's let time for those theories, you know, to come through. Then I'll get to them. So
Well,
anyway, sorry.
it may be such a thing that you can, even on the Amazon Look Inside feature, that you
Yeah,
could read
yeah,
the preface by Norman Doidge in 12
yeah,
Rules for Life, because
yeah.
actually that was one of my favorite parts of the book, was the preface
Mm,
by Norman Doidge. So when I received an email the other day from some how to avoid Alzheimer's thing,
mm-hmm.
that
Yeah.
they had done an interview with Norman Doidge, I thought, oh, I want to hear what this guy has to say. So I was listening to
Yeah.
him, and he was talking about many of the advances that have been made in brain science and in repairing traumatic brain injury and repairing brain dysfunction using light.
Mm,
And found that fascinating. He was especially mentioning that one of the ways they had discovered this was that they had discovered that light is valuable for repairing tissue problems and aches and pains and so forth. So they had some guy, they had put light on the back of his neck for a neck injury that he had to remove pain from that. And at the same time, they noticed that this guy who had been experiencing some sort of visual degeneration where his scope of vision had narrowed.
mm,
When they put this light on the back of his neck to get rid of the neck pain, his vision began to broaden out again. And when they realized this, they started giving him repeated treatments, and he was able to regain his visual faculty. So
mm,
they began to realize there's something about this light that maybe if we can get the light to the brain, and both light and neural stimulation. So they found that the tongue is a good pathway to get to the brain, and also this area on the back of the neck where the hippocampus is.
mm.
Um, and anyway, they've been doing a lot of, and I guess up the nose, they've been doing a lot of research on this issue with light. And I don't know that it has anything to do whatever with psychosis or any of those things, but certainly restoring memory and that kind of thing. They're making progress on those areas. So
But
we
you know,
don't
the
know what we're
sentiment
going to
is,
see in the future on that stuff.
I would be a lot more confident in the science if you come back to a more fundamental thing. Now, field of view, maybe you can measure, but it's still something going through what the guy thinks he remembers seeing. It's not like, again, you can't take a blood test, you can't do a
That's
measurement, you
mhm.
can't weigh it. And again, measuring somebody's behavior, even their memory, like for example, measuring pain, it's notorious, it's almost impossible. There's so many factors that change how you think about pain.
Mhm.
And then I think Kyle McNeese in the last study, thing with Paul was talking about placebo effect again, which is huge. My brother was looking up papers for something like a big new medication for pancreatic cancer, and there was the placebo, and it said, "Wow, it reduces the tumor size for 30%. That's great for pancreatic cancer." Well, the placebo was 15% reducing the size of the tumor. I don't know how much just, tumors may be reduced by themselves or just they think they're reducing, or there's so many things going on there. Like I just thought of like with the light, maybe their vitamin D levels going up. There's like now hundreds of studies of vitamin D for everything. Take more vitamin D. What it happens to be. But the sense of anything that's your brain is better. And you're doing your clinical trial, which again, a clinical trial is so. I'm involved in. If you take perfectly genetically tuned mice, put them in exactly the same environment, and do the one little thing different to them, you get scatter in the data. It's just hard to do experiments on living things and people even more. And for that reason, again, especially with the brain stuff, right? They say you have to take this medication, otherwise you go to jail. And by the way, it's probably going to wreck your kidneys or your pancreas or your thyroid or something else. And who knows what's going to work, my opinion. Based on what? This kind of data where I was with the psychiatrist, an expert. She had no way of knowing what my brother was thinking. So what is she going to do in her next trial? How are they measuring that? What are they doing? I find it very, very problematic. There was a couple of books, in the one article of my brother, I mentioned them because it was, people at the highest level. This one, the reviewer was the former editor of the New England Journal of Medicine. Said, basically all the data is placebo effect. That's all we got right now. And that was like 4 or 5 years ago, maybe, that those were done, or maybe longer now. But so anyway, I mean, I don't want to say anybody's doing something wrong. It's like if somebody said, if you sit under this crystal or this pyramid, maybe it helps them. I'm not going to say they're wrong. Or I've had friends talk about taking their children to an exorcist or dealing with the power of the Great Pyramid and all kinds of things. I'm not saying they're wrong, but if they tried this rational Western mind is a clinical trial, is the only truth allowed in our medical system. Well, their truth is as good as most of the stuff in the modern medicine that's still uncontrolled. Mm-hmm. And, for example, one of the things they've thrown out, and actually the history of the American Medical Association and all these things is interesting, from a libertarian standpoint. It's a market capture operation. So there was lots of different types of medicine. So here, at least in France, they still had homeopathy as opposed to the allopathy. Mm-hmm. And it's still like in a pharmacy, and they still have people around here practicing that. So I think the medical profession here is trying to get them, banned from getting any payments for anything anyway.
Sure, it's a licensing issue, right?
Licensing. So you license away everybody else that doesn't go with your view, which follows. What's the view? What's your symptom? I got the chemical for you, and it's going to be a chemical that's isolated, so we can patent it. It's not going to come from a plant, and it's going to cost several million to do the clinical trial to give you the proof that that's the best thing. And if anything else, it's a system made to produce what it's produced. So, those are long things. I've thought about them quite a bit. I don't know if I have enough material to document everything in a way that would be an academic treatise on them, but certain
sure.
experience.
And as you say, so many of these things are anecdotal as well. So I know for me, somebody told me 25 years ago about a product called acylcoccinum, which is a homeopathic medication that you take at the first sign of any sort of cold or flu or fever or anything like that. And so I started doing it 25 years ago, maybe 28 years ago. And when I had my daughter, I gave it to her starting at the age of 2. Whenever she started getting sick, I would give her this stuff. And in 28 years, I think maybe once or twice, either one of us has ever had cold or flu that lasted longer than 12 hours. And who's to say why that is? Maybe it was completely a placebo effect, but it's been very effective for me, keeping me away from doctors, keeping me from being sick, and I'm perfectly happy with it.
That's
You
my
know,
point, and that's the sense of, is that, the sense of authority, maybe getting back to, this aspect of reactionary libertarian or radical and conservative or something. But, what is the authority? So we could say, what authority would I say? Like, well, what can you trust? What's the top of the hierarchy? Oh, maybe, that is Jesus up there. Maybe not the church, but certainly Jesus as best as I could understand it. Whereas the rest of the authority, especially when the authority is coming, in the end at the barrel of a gun, this is what you believe about history. This is what you believe about medical care. This is what you believe about justice. What's moral. And if you don't believe, if you don't follow us, more and more, well, that's it for you. You don't last here. So, that's
well, which is kind of the story of Jordan Peterson's whole discussion, is
yeah.
that if we don't have, he doesn't say what it should be, but he says if we don't have the right thing at the top of the hierarchy, it will inevitably devolve into an authoritarian barrel of a gun issue where everybody is going to have to knuckle under to whoever's at the top of the hierarchy.
I
So we
certainly
better
see,
find
again.
out who's the proper one to have at the top of the hierarchy. And
Yeah.
you
So
and
I mean,
both agree that that's Jesus. So.
I'm looking at U.S. now from a distance, but especially universities. But boy, I was teaching at universities before I ended up in France, and I didn't plan on leaving, but I kind of say, wow, I may be lucky I got out when I did. Now, I was in engineering, so we did less of those issues, but I think they're going to be everywhere, or are everywhere. So
Looks like you're needed. So
maybe, yeah.
yeah.
It's
So this has been really great, Ira, and,
yeah.
and I hope we get to talk again sometime, because I would love
Yeah.
anybody who's listening to hear your backstory.
Okay, well, yeah, hopefully as they try to be, I'll even subscribe. How about that? At a
That's
minimum.
good. And if there's
Okay.
anybody that has been on my channel before that you would like to have a conversation with, I can put the three of us together. So
Yeah, well,
give
the
that
one
some thought.
who I think I obviously would relate to a lot, though we certainly have some fundamental differences, is Carl. I mean, a lot of what he says, well, yeah, of course.
Yeah, that would make an
And,
interesting
yeah.
conversation. Let's do that.
Paul also is obviously, he's not necessarily understand. Paul says a lot of things lately. He's been in several different ways, but also Carl, the sense of being outside your own culture, the importance of that. I've tried to, written about that, especially for U.S. Students. Say, I did some study abroad with students at different places, and it's such a difference in like an 18 to 20, 22-year-old American to get out of that ridiculous cocoon of the university where you have zero responsibility except go to class, and even that, we'll feed you, we'll do everything, you do nothing. And you'll be perfectly safe, versus get out in the world and actually, go meet people, deal with things yourself, etc. So anyway, yeah, maybe that would work out and be interesting.
Okay, very good. We'll
Okay.
talk to you soon.
Okay, bye for now.
Bye.